Namaste, Dr. Rajkumar.
Namaste, Dr. Imya Krishnan. You sent me one video of PowerPoint presentation of Dr. Kishore Patwardhan, which was regarding why do Ayurveda theories need revision. That is the title he had given. So we thought it is a topic which needs to be discussed widely so that more clarification is required on many things, and we would like to ask these things, present this before Dr. Kishore as well as others in Ayurveda professional community. So this video is intended for them. So it is like, why do Ayurveda theories need revision? So the topic itself, I felt something really wrong in that, because Ayurveda doesn't have theories. Ayurveda has only theorems, because Ayurveda mentions the word siddhantas, tridosha siddhanta, panchamahabhuta siddhanta. So the siddhanta is not theory. Siddhanta is theorem. Parikshagir bahuvidam parikshya. Hedubir sadhayitva. Sthapyade nirnayaha. So it is done by multiple scientists. Experimentation is done in multiple ways, and finally cause-effect relationship is verified and established.
This is a natural science and it's experimented in natural ways, and this Karya-Karana Siddhanta, Karya-Karana relation is established. So in a natural science, when natural experiences are experimented and the cause mechanism effects are revealed, it will not undergo any sort of change because all these are natural processes.
So I think the basic understanding is lacking. He doesn't know that Ayurveda is the nature of science of Ayurveda and modern science are entirely different. Ayurveda is a deterministic science, and modern biological sciences are probabilistic sciences. So what is the difference? In deterministic science, there is no randomness in anything, because Karya Karana Siddhanta, cause effect relationship, is already verified and established by basic research and applied research in deterministic sciences. Just as in physics and mathematics, they explain the laws of nature. They explain theorems, laws, and principles, which can, by means of which can be employed in every period, past, present, and future, to explain the natural phenomena, to demonstrate the natural phenomena. That's why we are learning theory in labs first, physics labs, then physics classrooms, then we are going to lab next to verify what we have learned by an experiment, and we are concluding with confirmation.
We need not do repeated research to confirm that formula is correct or not, that principle is correct or not. So it is deterministic.
Correct. So the probabilistic sciences, biological sciences are probabilistic, and the outcome of an event cannot be predicted due to inherent variability and complex interaction between multiple phenomena. So they cannot understand, because they are practicing analytic reductionism, modern probabilistic, modern biological sciences. They cannot observe, understand, and comprehend a phenomenon in totality. That is why they are going for statistical studies, inductive reasoning, whereas Ayurveda is a deterministic science which advocates deductive reasoning. So there are no theories in Ayurveda, only theorems, laws, and principles. And he is telling Ayurveda is based on philosophical framework. Yes, it is based on philosophy, but it is a science, Shastra. And he also...
Padartha is not philosophy. So Padartha explains the laws of nature with which all the natural phenomena are explained. So when these are being explained, naturally Atma, Manas, etc. will be explained. That is not philosophy. That is its mode of explanation of the science is in that way. It is not philosophy, or Padartha Vijnana means it is the laws of nature with which the science is explained. So it has got clear cut Padartha, which are Samanya, Vishesha, Guna, Karmas, Dravya, and Samavaya. With this, the whole science is explained. For that, what all explanations are needed, that's given. That is not philosophical explanation which can cause confusion in students. It is the way in which they are taught is wrong.
So really you have mentioned a different thing, because in colleges we are learning in first year BMS, Ayurveda is philosophy, Padartha Vijnana is philosophy, etc. So that makes a big difference what you are told. and it is told that curriculum doesn't explicitly state why current sciences are taught, physiology and anatomy, and I think I agree to that point, because there is no interconnectivity in what is learned in modern science and Ayurvedic science, anatomy and physiology. What we are learning in DMS, that connectivity is not being revealed by the faculties,
Mode
right?
of teaching is wrong.
That's
It
what.
is not, they are not wanted or they are not needed. It doesn't mean that it's not taught in the proper way.
Yeah, so that is lacking. We are
Yeah.
not getting correct knowledge, and if the purpose is to fill gaps, definitely there should be a continuity between, I mean, everything should be connected and explained, and moreover, first year subjects, anatomy, physiology, everything, basic principles, all these are to be demonstrated in healthy volunteers and
No,
patients.
knowledge of anatomy and physiology will help to get clarity in Ayurvedic science,
Correct.
and as well as we will be able to know the defects in modern science also, or
Correct.
Western medical system. And physiology, everything is explained separately, like liver functions, brain function, kidney functions. But in Ayurvedic science, everything is explained based on functions, and it's in the highly dynamic, ever-changing human body is considered along with its circumstance or environment. So when it is considered along with its environment, the nature of functioning can be understood with Panchamahabhuta Siddhanta and Tridosha Siddhanta.
So this curricula needs to be reformed. That's what we were telling all these years, because people, Ayurveda students, are not getting clarity neither in modern science as well as nor in Ayurvedic science. So he is criticizing Tridosha by telling that Vada Pitta Kabha regulate body functions, and he says that he is asking that how well does it align with real life clinical encounters. He is a Kriya Sharira expert. In my understanding, he is a faculty of Kriya Sharira professor. But he is asking this question, but how well does it align with Tridoshas, align with real life
This is because of
clinical
basic
encounters?
ignorance or incapability to understand basic things. First, we need to understand what are Panchamahabhutas. There are all perceptible substances in this universe are made up of five kinds of substances with which we could percept. So, based on that five kinds of sense organs, all the substances are classified into five, and we don't have an extra sensory organ, so there cannot be a sixth basic structural element, and its nature is explained with certain functional units, functional elements or active principles with which we can identify that, as well as we will be able to know the functions it will be imparting in the body. And these Panchamahabhutas are perceptible form. All the perceptible substances are made up of Panchamahabhutas. And when it is functionally classified in a dynamic body, it has to be understood with its functions. So in a functional body, the basic Panchamahabhutas are classified into three functional elements, which are termed as Tridosha. So this basic understanding is lacking. That's why he is saying that this is a concept, or this
Belief.
cannot be, this is imaginary characters, or these are fictitious elements, and this cannot be explained in clinics. So that is completely wrong, and this is whenever it is perceptible, demonstrable, or repeatable, that is science, and all these Panchamahabhuta as well as Tridosha are perceptible as well as demonstrable.
So this clinical form of manifestation of Tridoshas are explained as Atmarupas, right? So I think he is not teaching that also,
and
he is
various
not
forms of
knowing
Tridosha,
that. Yeah.
various forms of Tridosha also need to be known, like pathological doshas are different from physiological doshas, which are explained for explaining the phenotype, are entirely different, and all these are explained with these functional entities or active principles. So the nature of functioning of these doshas in that specific body we can understand with the gunas. So all these things are basic things, and if those are not known, you cannot explain anything, and that is the basic defect what he is having.
So without knowing this, I don't know how far it is able to teach Kriya Sharira in a classroom.
Yeah.
And also this what you call applied physiology. In Western medicine, Western sciences, we are learning applied physiology. Do you not think that equally Ayurvedic applied physiology is to be taught? That point I was thinking of, which without which physiological and fundamental concepts of Ayurveda will hardly get clarified.
Ayurvedic physiology, the nature of functioning in that specific individual, based on his Prakriti, Sara, Samanna, Sattva, Satnya, Ahara Shakti, Vyayama Shakti, Vayas, there will be so many changes that we can understand with Ayurvedic principles. So it's not like liver is taken separately and we are learning about liver, we are learning about other organs. We will be learning in this unique environment what all physiologies, how they are functioning, how we can maintain health, how homeostasis is maintained, everything is explained there.
So he is telling about obesity in clinical condition, overnutrition leading to obesity. He is telling that Kabhavardhi is a hypothetical thing, hypothetical process. That made me surprised. Kabhavardhi is a hypothetical process, and in modern medicine he is substantiating by telling in modern medicine obesity can be explained by metabolism, psychology, biochemistry, etc. Whereas in Ayurveda, doshas are incapable to explain by obesity, and he is not aware of other factors which are involved in obesity in Ayurveda also. So he is asking, don't we need to substitute Kabhavardhi with these mechanisms like psychology, biochemistry, etc.
Actually,
That's what he is asking.
the Kapha Vritti term itself in a pathological process is wrong, because Kapha Prakopa is the term and he doesn't know the difference between Kapha Vritti and Kapha Prakopa. So Kapha Prakopa is a pathological thing and it happens by external causes with which internal and causative factor gets aggravated. So that is very well established in science. When these causes are taken, we will be seeing Kapha Lakshanas, and when those causes are not taken, Kapha Lakshanas will not be seen, and Kapha is able to produce a disease along with Kapha symptoms or dosha symptoms, and when specific treatment is given, that Kapha is getting subsided. So all these are not hypotheses. All these are what is happening inside the body.
Can
it's
be
very well explained.
demonstrated,
It can be
right?
demonstrated. Actually, this functional elements like gunas, when we are able to understand in the most appropriate way, we can explain all the biochemical changes that are happening inside the body, hormonal changes, what all effects are happening in each and every tissue, we can easily identify if we understand the basic pathological factors as well as its Shastra Arthas. I mean,
So
Shastra
I think that
Arthas.
is what is lacking today, Shastra Arthas. Translation is also only happening. So, and he is also telling that that cannot explain, through doshas cannot explain complex pathophysiologies, and predictability based on causality is poor. If predictability based on causality is poor, will Ayurveda explain Karya Karana Siddhanta? It is basic common sense.
It's not prediction, it is substantiating what is happening.
Parikshagir Bahuvidam Pariksha Hedubir Sadhaitva Stapyade Nirnaya is what is done in Ayurveda. And based on what you are telling, predictability is not based on causality is poor. Then Nidana Panchaga and all the different aspects of different tools of Roga Pariksha, Rogi Pariksha, etc. And everything like ego, hedur anegasya, tadhegasyega evahi, vyadher ekasya bhavo, bahunam bhavo pija. So these things, how they are to be
I don't understand
analyzed.
what he mean by complex pathology.
I think he might have meant multiple clinical conditions existing together
So
in a
autoimmune
patient.
conditions, it's not a complex pathology. If you understand the Shastra Arthas, not Artha of a verse, Artha means
Intention.
what you are understanding from the verse is Artha, and Shastra Artha is you are knowing in the subject or applied knowledge with that sloka, what you intend to understand is Shastra Artha. So if you are not knowing the Shastra Artha, you will be, all the pathologies seem to be complex. If an autoimmune condition develops and afterwards he develops diabetes, along with that some infection, urinary tract infection or something happens, along with that some external factors, some trauma happens, all these pathologies can be identified in the subject with Vyadhi Prabhava Tattva. So that is very well explained, and if he is not able to understand, that is his own problem. It is not the defect of science. So, and because of his defect, he is asking to update science and change the curriculum. Curriculum needs to be changed, but not to update Tridosha or Panchamahabhuta Siddhantas.
So it is like, this is one thing which I am really proud of in SBBA, because we are treating patient multiple diseases together. Patient might be on 8 to 12 drugs. We are stopping everything from day one. We are applying Vyadhi Bheshaja Prabhava Tattva, and we are applying minimal medicine, 1 or 2 medicine in fragmented dosages with scientific nutrition, Pathya. And we are able to reverse the diseases in less than 20-25 days. Reverse means we are taking the patient to such a state where he doesn't require any medicine from any system. So this is possible. If Dr. Kishore must understand that if there is a medical system which is capable to handle successfully, effectively handle complex pathophysiology, it is Ayurveda and Ayurvedic science alone.
Only.
You should be really caring to learn something before you make such blind statements. So in all diseases, he is telling limited set of diet, lifestyle related factors that have been identified that lead to Vada, Pitta, Kapha. In all diseases, they need not hold good.
Limited diet, limited regimen. So Ayurveda explains everything with its basic nature. Basic nature means which will never change. The basic nature, if you explain 6 rasas, it will never change. Or 20 gunas, it will never change. So everything is explained based on this basic nature. So when this basic nature is explained, there is no limitation. Whatever thing or whatever perceptible thing or seen or unseen factor, the changes inside we can easily identify with the nature of response. So with the nature of response, we can identify the nature of the cause. So when we identify the nature of cause, we can definitely reverse the condition by giving opposing, means hostile environment inside the body and opposing factors as treatment.
He is telling endocrine physiology was not known when Samhitas were written. So he doesn't know means endocrine physiology, he is not sure what it is in Ayurveda. Maybe that is why he is making this statement.
His ignorance is projected as
generalized
science defect.
That's what. Aldosteronism causes sodium retention and increased blood pressure. Incidence is more, and it can lead to muscle weakness, fatigue. It is not possible to explain by Tridoshas, all these. So it is.
Before telling all this, he should first try to understand what is homeostasis in Ayurvedic science, how homeostasis is maintained, how Panjavayus are acting. So Prana, Udana, Vyana, Samana, Apana, how they are involved in maintaining the homeostasis. So if he knows that, then such question will not arise. So adaptation, how it happens? Adaptation happens initially by Panjavayus, later by Agni, action of Agni. So renin, angiotensin, aldosterone mechanism can be easily understood, explained and demonstrated to students as well as public.
So Dr. Rajkumar has written a book, Unveiling the Truths in Ayurveda, which has explained the basic physiology, how to understand the basic principles in a living human being in different conditions of health and disease. So I think it is...
How to understand in human body is Shastrartha.
So this has to be compulsorily there in the curriculum. It should be taught and trained in anatomy, physiology, basic principles in the first year. This book should be there in every college, in every part of India, wherever BAMS is taught and trained professionally. He is telling that diagnosis and treatment without modern investigation is impossible. That is correct. It is not always correct, but it is always welcome. Modern investigation will...
We can confirm
we can
all these conditions with modern diagnostic methods, because all these increase our pratyaksha jnana. So imaging scans. So we will be able to visualize. We will be able to perceive what is happening inside. So that's not contradictory to Ayurvedic science. And all investigations will be giving a picture regarding doshas also. It's the Asheshamya Vyabhi Eduktam Dosha Lakshanam. We are finding dosha lakshanas or dosha features in these investigations also. So as they are not able to understand the modern uh, lab investigations in Ayurvedic perspective. These comments are coming, like investigations are not needed. As when we know that all these are structural elements and their functional aspects are explained, then we can easily find out the structural abnormality as well as functional abnormality with this lab investigations also. We can confirm with lab investigations and imaging scans.
We can avoid unnecessary tests. We can indent the necessary tests also.
Yeah.
And we can make our diagnosis and treatment more and more accurate and predictable by incorporating judiciously incorporating lab tests. And he is telling that the sudden onset of seizure by brain tumor, Ayurveda cannot explain by Nidana Dosha Doshya
So he
axis.
should know about seizure, how it's happening, like how prana is functioning, how vyana is functioning, or prana vyana dysfunction, how it develops, what all are the causes for prana vyana dysfunction, which all processes can affect prana function. So brain tumor, how it is going to affect. So pathological factor or its internal physiological factor itself is causing. When we understand and when we are able to differentiate, distinguish between all these things, then this is very clear and easy to understand. So MRI scanning is a mode of Pratyaksha aid. That's all.
So it doesn't mean that it is deviating away from Ayurveda. Whatever we are understanding and applying should happen by Ayurveda. Ayurveda is a science. Science means the knowledge which is intended for application, understanding and application. So that is what is called determinism, deterministic science. And he also mentions that Ayurveda anatomy and physiology contradict modern scientific findings. That is so funny and what do you call ignorant way of making statements. What do you think about it? Ayurveda anatomy and physiology contradict modern scientific findings.
Ayurveda explains how to understand the arthas, meanings. So it is not like Sanskrit verses are just translated. So according to the context, we need to understand whether it is explained functionally, whether it is explained structurally. So in specific context, we need to understand whether it is structure or function. So based on functions, what all things when we need to understand is understood, then this confusion will not arise. This anatomy, physiology knowledge will help us to understand human body in more detailed way, and as earlier I told, we will be able to know what all defects are there, because physiology is explained separately for each and every organ. But in Ayurvedic science, the cause-effect relationship is established, and it's for physiology also as well as for pathology and for treatment. Everything is explained along with food, diet, food regimen, activities, and also each and every activity is also explained. Sleep, walking, exercise. So each and every activity, each and every nature of food, everything is explained, and its response of the body is also very well explained. So as he is not understanding the basic things. So where to understand anatomy as anatomy and where to understand physiology as Ayurvedic physiology, that he needs to understand.
So these things are to be understood first. And he is also telling that formation of Shukra from Majja, tubular connections, how Majja from Majja Shukra is coming, and tubular connections between intestine, urinary bladder, embryogenesis, semen and menstrual blood is uniting and embryo is formed. That is so funny, no? So Ayurveda is full of fun.
Yes.
That is what
Majja from Shukra, Shukra from Majja, all these are, when you take literal meaning, all these come. It is Thadu Poshana Krama or Thadu Sneha Parambara. Thadu Sneha is precursor Thadu, which is being circulated, and from after one Thadu gets nourished, the second Thadu gets nourished. That is the method which is explained, but it is explained as Rasa will be converted to Rakta, Rakta will be converted to, and Majja will be converted to Shukra. That's all. That is purely ignorance. It is not the science.
That's how it is taught.
After nourishing Majja, Shukra is nourished. So that meaning is distorted, and it is explained as Majja is converted to Shukra Thadu. So that is rubbish.
So the precursor sneha in Majja is contributing to Shukradhatu. Recently I saw a research which is very accurate. They are in the beginning stage, modern science. They are telling that according to this research, the precursors of sperm in bone marrow are considered to be spermatogonial stem cells, which are early stage sperm cells that can be induced to develop from bone marrow stem cells. So this research, they are telling that it is in underactive phase, but studies have shown that scientists can cultivate spermatogonia from bone marrow. Okay, bone marrow stem cells taken from male volunteers, and this will contribute to male fertility. So they are now understanding that the precursor things are there in bone marrow, and we are just denying. Just imagine, he told that Dr. Kishore was telling that Ayurveda lacks scientific tools. Dr. Kishore must know that scientific tools means the tools which are employed in the science to understand and apply science. It is not like technological tools always. Not necessarily technological tools. You think that, what I believe is, you think that whatever technological tools are called as scientific tools. No. Scientific tools means the tools employed in the science. It can be knowledge tools also. We don't know what kind of basic research tools were employed by these scientists to understand this. Just imagine, can we imagine? These things are now in budding research, which are already established in Ayurvedic science, Majja and Shukra. And also I have seen regarding this Artava also, this is quite interesting. It is mentioned that the endometrial mesenchymal cells are derived from bone marrow. So it is like Majja, Artava is mentioned as next Dhadu in Bhavaprakasha. I have mentioned this in detail, this gynecological physiology in my book, Ayurvedic Gynecology. I have explained the entire physiology of gynecology in my book. So these things, because of your ignorance and our ignorance, we are interpreting it as flaws in Ayurveda. Please understand that Western medicine is in budding stage of basic research. We are in advanced stage. We means Ayurvedic scientists in those days are already in advanced phase, but much unimaginably advanced than what Western medicine is doing now.
Tubular connections is again Srotas he needs to understand in detail.
I think
so
that is
Mutra Vahipi Sirapit Puryade Basti. So he needs to know how Srotas functions. So functional aspects, if he understands, then in which context we need to understand it as anatomical, which context we need to understand it as physiological. That differentiation should be developed.
That there is no contradictory perspectives, because in Western science also they are doing the right method. Even though it is analytical reductionism, it is not like Western medicine. Western science, biological science and Western medicine are different. They are trying hard to understand certain things, maybe in an isolated setting, in a lab, in a test tube, but what they are doing is also somewhat correct in reductionist manner. But Ayurveda is much more than this. So we should be able to understand Ayurveda first before making such statements. He is telling discovery of cells, DNA, hormones have made the science change dramatically. He meant Western science. Ayurveda theories are unchanged because of these advanced.
When basic nature is explained of natural phenomena, then it will be unchanged. So it can never change because natural phenomena are not getting changed.
So he is asking whether Hridaya means heart or brain.
So basic, he doesn't know even the basics. He is not able to understand. His incapability he is projecting as flaws of Ayurvedic science. Hridaya, in structural aspect, it is explained as Tana Urakoshta Madhyagam. So you can understand it as in Hridaya or in middle mediastinum, and it's also explained as Rasavadadi Marganam Sattva Buddhi Indri Atmanam Prathanasya Aujasasteva Hridayam Sthanamuchede. There it is functional Hridaya. So there is no confusion if you understand the science in the most appropriate way. And below this, I have seen so many comments supporting him. So that shows the diffident attitude of Ayurvedic community. So they are not able to understand, and they are supporting what is written against Tridosha Siddhanta, Panchamahaputa, the basic Siddhantas. So that means if they want to change the curriculum means Ayurveda will not be there.
Yeah.
That's what they wanted. I think he wanted to means abandon Ayurveda from the science.
See, Ayurvedic biology, Ayurveda students should learn. No, Ayurvedic physiology, Ayurveda students must learn. That modern physiology will help them to become confident in Ayurvedic physiology.
Being a professor in Ayurvedic science, this is a crime. I think this is a crime.
Really, I agree with you on that point, because unless he is clarified on these aspects, he should not be taking classes.
He should not remain as faculty,
right,
unless and until this gets clarified.
Right. If I am in his place, I will not go to class. What will I teach students? If I don't have clarity regarding all these things, I am not intended to teach students. That is correct. And Ayurveda textbooks contain outdated physiology and anatomy. He is telling outdated physiology and anatomy. Dosha theory has limitations in explaining many medical conditions. Understand that it is your own limitation. It is not the limitation through dosha. You have to travel really long. You are with dedication and submission.
You are not capable to understand Ayurvedic verses, Shastrarthas, its Pratipatti Jnana, how to apply. So all these are making you comment like this.
And reformation in Ayurveda education is required, especially to avoid building up of faculties like him. He is just a specimen of a big professional community of faculties who are not able to explain things, who are not able to clarify things, confirm things, demonstrate things, those who will not appreciate asking questions, those who get arrogant on receiving questions. Such kind of faculties I am hearing from students. This trend should stop. For that, there should be continuous orientation programs in SBBA, right?
Yeah.
What do you think?
Updation should happen in the brains of physicians. Smritiman hetu yuktitnyo jitatma pratipattiman Hishag aushada samyogir chikitsam kartum arhadi. So they need to be Smritiman hetu yuktitnya jitatma pratipattiman. There is no updation needed. Updation is needed in the brains
intelligence of the physicians. So that is why Acharya told Shastra Artha Karmanushīlanena Samskurveda Pratnyam, because Vimala Vipula Buddhera Buddhi Maguli Gudya. This Dr. Patwardhan must know, even for those people who are having profound intelligence, they can get confused when they start to learn Ayurvedic science. So
first they need to learn Shastra, then Shastrartha, then Shastrartha Karma. They need to practice.
Shastra Artha Karmanushīlanena
Anushīlanena, you need to continuously practice. Tasmat, so it is mentioned as Tasmat Abhikshnashaha. You have to continuously, always, you need to ponder on these things. You need to apply based on Shastra Arthas, and this Shastra Artha Karmanushīlanena, you can remove your confusions. You can.
And also, I would like to say that SBBA is such a kind of work where science-based medicine, Ayurvedic science-based medicine, everything, anatomy, physiology, pathophysiology, and in almost pediatrics we have done.
Regarding gynecology, she has written an excellent book, updated along with obstetrics.
And the attitude and approach of science is discussed in the Mission of Science. I mean, the science of Ayurveda.
First, he should understand this book, Mission of Science in Ayurveda.
Mission of Science in Medicine. So that is to be understood. All these are intended to be curriculum books, right?
Yeah.
Curriculum textbooks. Then such kind of
once SBBA comes in the syllabus, all confusions will get.
And faculty should receive orientation also in SBBA. So our intention of making this video is honestly not criticizing or blaming any person. We just want to project the flaws which are very much, because he is going to present this before a scientific audience.
So
and
this
it
is
not
completely
really worthy to do this. He is insulting Ayurvedic science. He is humiliating Ayurvedic science without knowing anything.
This is complete wrong. From the first to last line, everything is wrong. So, or his what he understood is wrong. So that's why this presentation has appeared, and so many people are appreciating and supporting.
So we consider it as our humble duty and responsibility to clarify things. That's all. Namaste.
Namaste. Thank you.